Good morning, everyone. My name is Julie Frausto, and I am with Inspire Sheboygan County, and I'm excited to be here today with Amanda Hogan. Today's session is brought to you by the new AHEC, which is the Northeastern Wisconsin Area Health Education Center, and Inspire Sheboygan County. So, Amanda, we're going to jump right into our Q&A with you. I'm going to ask you the first question, and then if we want to get into some of the slides that you have to share. Students and educators, just a reminder that you can share your questions or comments in the chat box, and how the questions come in will be how our conversation goes. So please, anything you want to know about this career, type it into the chat box. So Amanda, tell me where you were at in high school, like as far as were you thinking, oh, I knew I wanted to be this, or tell us about your career path.
Yeah, I actually thought that I wanted to be a pharmacist when I was in high school. I think a lot of it had to do with the money aspect of it. I kind of wanted a nice paying job and didn't know much about a lot of professions in healthcare, except for nursing. And I knew a little bit about pharmacy. So I explored more the medical fields. And it wasn't until I was in college that I realized there's a lot more to medical than what I had thought. So I did a lot of research, and I actually went into radiology or x-ray first. And that's where I got it kind of exposed to more ultrasound at that time.
Okay. So you were in college when you kind of did that research. Would you say it would be helpful for students to do that in high school? Would that be?
Absolutely. Yes. I feel like I was kind of wasting some time in college because I didn't know what I wanted to do. And I think it's fine if you don't know what you want to do, but definitely exploring all the options available to you. There's a lot more resources online now than what I had available to me, where you can actually see what people can do in the healthcare field or any field. So definitely do your research before college, hopefully, so that you don't waste a couple years like I did.
Yeah, that's a great idea. I have a senior in high school, and I always told her do it in high school when it's easy and free. Because when you get to
Exactly.
college, you're paying for that. And so if
Exactly.
you change your major several times, you're paying for all those classes. So always good to learn, but right, we hate paying for that, especially as student loans. But
Yeah.
okay, so you kind of found it. So you got into X-ray first. How did it then lead you to where you are today?
Yeah, so I got to do a whole week long job shadow in ultrasound. And I know COVID's kind of put a wrench into job shadows, but I highly recommend them for any student because it shows you the real in and out of what a day is going to look like in that profession. So I did a whole week long tour in ultrasound, and I thought, wow, this is really interesting. I think that I could do this forever. So I went to ultrasound school and I worked as a sonographer for about 12 years now. And within the past 5 years, I moved into more of an educator role. So now I teach ultrasound, but I still practice in the field.
Now, so do you have an undergrad degree, like a 4-year, or what kind of schooling did you have to get?
Yeah, so for ultrasound, there really is all kinds of different schooling. So there's certificate programs. So it's more like a year long or a year and a half. Generally, you have to have an x-ray background or a different bachelor's program. There's also associate degree programs, and there's also bachelor degree programs. So there's a lot of different avenues. There's a lot of different specialties within ultrasound that you can choose to go into. And so depending on how many of those specialties you choose really lengthens or shortens your education.
Okay, so are there any pros or cons to the different educational pathways, the certificate, the 2-year, and the 4-year?
Great question. I think more so instead of what you're getting at the end, it's going to be, what do you want to do with it? So do you want to just do OB work? Do you want to do vascular? Do you want to do cardiac? So vascular is kind of that unique field now that more hospitals and employers are pushing sonographers to have, where in the good old days, it used to just be general ultrasound, which is abdomen and OB. So really it depends more so on the specialty you want to learn. But then if you do get a bachelor's degree, ultimately you have to have that to be in any management role. So if you were ever thinking that you wanted to be a leader, it would be a good idea to get a bachelor's degree.
Oh, good, good. We have a question already from the
Good.
students. They would like to know where you're employed. And I apologize. I think I forgot to ask that as well.
Yeah, no problem. So 2 places, Bellin College. I'm the program director for ultrasound here at Bellin College. And then I also work at Bellin Health. I work in the OB MFM clinic. doing high risk ultrasound.
Okay. And so I always like to tell people you use the terms that you're using, like OB, vascular, just to explain for the students. Can you tell us about the different areas that ultrasound can be done?
Yeah, I'm actually going to share my screen because I have this
Perfect.
little PowerPoint here that I think will make a little bit more sense.
Okay.
So we have cardiac. So when you think of cardiac, we always think of hearts. So you can see in this image here, yes, you can see well. So here is a beating heart, and this is the left ventricle over here. Here's our right ventricle. This is a valve of the heart that you can see. So with ultrasound, we can actually assess how well that heart is beating and if there's any pathologies in the heart. So that is what we term cardiac ultrasound or cardiovascular. This is an adult heart, but we can also do this with pediatrics. So anybody under the age of 18. And then we also do it neonatal, meaning inside mom's belly while she's still pregnant. We can specifically look at a heart.
Wow. How do you do? Well,
no, you can ask. Go ahead.
I mean, how do you do that?
It's really hard because babies move a lot. So when we evaluate a neonatal heart or a fetal heart, a baby heart, it's the size of a quarter. And we are looking for little tiny holes in there. So really, if I had to term a sonography job into a couple words, it's that we are detectives. We are looking for pathologies. We're the eyes and the ears of our providers. And we find the pathology and then show our cases to a provider who then reads that study and provides treatment.
Oh, great. Thank you.
Yes. All right. So the other concentration is vascular. And this is one that's more of a new concentration or a new specialty to a lot of education programs, and one that a lot of employers are requiring their staff to have now. So vascular, we're talking about all the arteries and veins that are in your head to your toe, basically. And so what can happen in an artery, which I have here, this is an artery, that's your carotid artery in your neck. And think about what happens when you put your thumb over a hose. What does the water do? Does it slow down or does it shoot really far? And you know, when you put your thumb over the hose to squirt your friends, it's because it shoots farther. It has to go faster. The same thing happens with arteries in our body. So this right here is plaque, or basically junk in the inside of an artery. So what happens is blood flow is going to have to go very, very fast in this area. So we can help our physicians figure out how fast that blood flow is going, and if a patient needs treatment today, or if they can wait and we can just watch it. So that's vascular.
Wow, that's really a great analogy. Thank you for that.
Yeah. OBGYN. So when I tell people that I perform ultrasound, this is the first thing that they think of.
Right.
My goal today is for you to know that we do way more than just babies. So these are baby pictures. So we have our cute little fat-cheeked baby up in here. Again, we're looking for pathologies. So a lot of people are under this conception that we just look for gender. Is it a boy or is it a girl? But what we're really looking at is from the head to the toe on that baby. Is that baby normal? So I have a video here, and I know that everyone can't read ultrasound, but hopefully I can help point it out. This is a head. If you were going to cut me in half here, and I'm going to pause it here. So here's the skull. This is the brain coming out of the skull. So this baby has a defect of its skull, where in the back, there's a hole and brain contents are coming out. This is the same baby with a 3D picture. So you can see the skull is here. Here's a cute little ear. Here's some shoulders. So you're looking at the back of baby. And this is brain contents coming outside of that skull. So clearly this is something that we have to find as sonographers, because the treatment is needed for this baby to be delivered somewhere besides a rural hospital. They need a lot of high level care. Can be sad, for sure. OB can be sad, but it's also a very happy time with any specialty in ultrasound. Okay, the last one is abdomen. So
we had a question come in. Sorry about that.
Yeah.
Can a baby with the brain coming out, can that baby be saved?
It depends on what's in there. There is actually amazing work that is being done. I just read a research study that they're performing surgery on these babies before they're even born. And so when they come out, they're already repaired and they have a much better chance at being cognitively or mentally normal.
Wow.
Babies are very resilient. You'd be surprised the stuff that we can see that they come out and they do pretty good.
Yeah. Wow. That's awesome. Thank you.
Yeah. So this is abdomen. So we also learn abdomen in the sonography world. So every organ from your head to your toe, we basically look at, with the exception of anything that's filled with air. So ultrasound and air don't go together very well. What happens is our ultrasound comes down and it hits the air and it bounces back, so we can't get an image. So if you think about what's filled with air in the body, your lungs, bowel, so small bowel, large bowel, stomach, we just can't see those very well with ultrasound, but everything else we can.
Yeah. Do you see the outline of them or?
We do. We'll see that the first layer basically before everything gets bounced back to us.
Okay.
Here's a picture on the left-hand side. And you're just going to have to trust me with this because I know it's hard to see. It takes a while to learn what pictures look like. But this bright white circle right here is actually a tumor. This is a cancer in a pediatric kidney that we found. So the normal kidney is right here. And here is this tumor. Again, sad, but these patients do exceptionally well. The cure rate is very, very high. And in our role, we have to think we're finding these pathologies very early so that we can help patients and save patients' lives.
What, oh, sorry.
No,
I was just going
ahead.
to say that looks really big.
It is.
You know, is it magnified or what is the?
Yeah, so there's a little trick here where you can see, do you see how it says 2, 4, and 6?
Mm-hmm.
Those are centimeters. So it's probably about 4 centimeters large.
Okay.
Over here, this is an adult abdomen. And you see this little tiny white area here. Mm-hmm. That is a hemangioma. So fancy word. And it really is just a insignificant finding, meaning that a lot of people have them. It is not cancer, it's benign, and it's not a big deal. So we find a lot of things that maybe don't even matter, maybe are the reason for a patient's pain or a reason why they might need treatment.
Interesting.
Yes. I will stop sharing my screen here.
Okay, wonderful. My son had an abdominal ultrasound. They wanted to make sure everything was in the right place and nothing was flipped around and things like that. So it was really interesting. He was thinking, why am I doing this? Only babies get looked at this way.
Right. Yeah. That's the common misconception is that we only scan babies, but we do a lot more than that.
Right. And I know it's done for breast ultrasound as well. Can you explain that as well?
Yeah. So breast ultrasound is a tricky one because I tell all my students, it's kind of like looking for a fish in an ocean. If you're looking for a breast cancer, if you're scanning a breast, it's like looking for a fish in the ocean. It's so important for us to work with other imaging modalities. So a lot of women, almost all women, have to have a mammo, and men too, because men get breast cancer. They do a mammogram before they would come to us in ultrasound, and the mammogram can tell us, look here. So instead of looking in an ocean for a fish, now we're maybe looking in a tiny puddle. So we know where to look for this mass. Otherwise, it's very hard to use ultrasound to look at an entire breast to see if there's a pathology.
Yeah, that's a great analogy. Again, helps the visualization process. Yeah. So you started in X-ray and then moved to this. What was the interest in changing?
Ultrasound is very much user dependent. So everything that I do is with my hands. I have a probe that I hold like a camera, and I am the direction master. So I angle certain ways to get the picture. So if I'm angling one way and I miss something, that's on me. And I love that high level of trust that the providers have with you because you truly are their eyes and their ears. Mm-hmm. Our exam times are a little bit longer, so like 30 minutes to an hour, depending on which type of exam we're looking at. And I really liked that extra time with my patients rather than only having 15 minutes or 5 minutes with my patients.
Yeah. Do you ever get to go into surgery?
We do. A lot of things you wouldn't think about. So some things that we do are we will help find the borders of cancer. So the edges is what I mean by that. So we might go into surgery if someone is getting cancer of their kidney removed, and we would go in and actually scan that kidney to make sure that we got the borders of that cancer. We do a lot of vascular procedures up in surgery. So definitely a whole nother area of ultrasound that you wouldn't think we'd have to do.
Yeah, I can see where vascular is becoming much more important. So looking, if you had to like start over, would you have chosen a different, not chosen a different path, but to get to where you are, would you have done anything differently?
No, because there's no redos with me. I am glad that I did the path I did because I had that unique background with radiology. And really, in the old days, that's kind of how sonographers came to be, is we used to go through radiology first. We would be radiologic technologists or x-ray techs, and then we would cross-train on the job. That's not really the case anymore. So now you basically know that you want to do ultrasound and you either go into cardiac or you go into abdomen. There's not really that crossover anymore where you're in a different profession and then you learn ultrasound just on the job. It's a schooling now.
Yeah. So when you're working in a hospital or clinic setting, tell us about what a typical day looks like.
Yeah. So we typically have a schedule set. So I might be going to work to scan cardiac, and I'm going to be scanning maybe 8 patients a day. And I have my set schedule. So I have a patient at 8, 9, 10, 11, 12. But it's a hospital. So things are always changing. There might be add-on procedures where someone comes in through the ER and needs something, or an inpatient needs something. The biggest thing is that in healthcare, hospitals don't close. So you are going to have to expect that when you are a new graduate, you're going to kind of have to work those hours that might not be so pleasant. But eventually you work your way up and you get to work during those banker hours or 9 to 5. But there is always call of some sort in a hospital. And what I mean by that is that you get to go home, but you carry a pager or you have your cell phone. And if there's an emergent exam where a patient really needs that ultrasound, they'll call you in. You go to the hospital or clinic and do your exam, and then you get to leave again, but you're still on call or you can get called back.
Okay. Wow. So what do you like best and what do you find the most challenging in your work?
The thing I like best is that it's different every day. I never have a day that is the same. So I might be in the OB world scanning 10 babies that day, but every one of those babies is completely different, and the anatomy and the pathology that I see might be completely different on every single baby. So no exam is the same. I really like the hospital world because you might do one baby, one abdomen, maybe a thyroid, and then you have a cardiac exam. So there's a lot of variation. The hardest part that I think was, as a new grad, not taking those emotions home with me when you found something that was really sad. But you have to change your mindset to, yes, it's terrible news for your patient, but if you wouldn't have done your job well, maybe that would have gone undiagnosed for another 3 months, where you just found something that could potentially save their life because you found it early. So I think learning how to process that and deal with those emotions was hard at first.
Yeah. Yeah. Let's talk about your work at Bellin College. So what was your actual major in college then?
Yeah, so I did major in sonography.
Okay.
I went back, I did a certificate program, a year program out in Colorado, and I actually went back for my bachelor's degree, and I got that in healthcare administration. I got my master's degree in healthcare administration, and I also have my doctorate in business.
Oh my goodness.
I've been going to school forever.
Yeah, and you're so young.
Well, thanks.
Yeah, that's incredible. What drove you to continue on with schooling?
I really like it. It's interesting to me. I feel like the more education that I have, the better education I can give to my students. So I'm super passionate about it. I love learning, and ultrasound is forever changing. So what I learned 12 years ago or 15 years ago is almost obsolete today. It's so different. So you do have to continue learning in the medical field. It always changes.
Yeah. So tell us about Bellin, the program that you have. It's a 4-year program?
Sort of. So it's a bachelor's program, yes, but we do it in 3 years. The reason for that is that hands-on scanning that I told you about. So if our students had off they're actually off this week, if they were not coming back until the end of August, it would be really hard to retrain that hand and mind coordination to do that. So they have summer semesters. So it's 3 years, but full-time. We still get breaks, but you do have 3 semesters a year. We talked a lot before about like the specialties with ultrasound. So we have 2 different tracks. You can do abdomen, OB vascular, or you can do cardiac, adult, pediatric, and then the vascular track.
Oh, wow. That's super. And has that developed because of the need in the marketplace?
Yes. We've had our general, our abdomen, OB, and vascular track for 5 years now. We've had 3 graduating classes. And what happened is the cardiologist at a local hospital just can't find sonographers to do cardiac ultrasound. So we created a certificate program at first, and it still is not meeting the needs. So now we created this bachelor's program that just starts their first class this fall.
Wow, that's incredible. So what is the marketplace need for them right now? Just not that many people going into it, or?
It's just so specialized and it's kind of a secret. Not a lot of people know about ultrasound. And if they do, they think babies. But there's so many different avenues. The job market has always been great in the area, so much so that I just had 8 students graduate and they almost all had jobs before March even hit. I mean, they were
Wow.
scooped up so fast, and I have more employers asking if I have grads, and I just don't have enough to give out.
Wow. Do you know the starting salary for that?
Yeah, it's right around 65 to 75,000. So definitely a
Wow.
great paying job.
Yeah, that's wonderful. Would it be similar for the non 3 or 4 year student?
It is. It depends on the employer, but it depends how many board exams or specialties that you take. So the more education, so we teach vascular, which some places don't teach, that will increase your pay a little bit. Usually the bachelor's program can also increase your pay a little
Wow. That's so interesting.
bit. Yeah.
Okay, so I'm just kind of going through this. What do you think is your most important workplace skill? When we talk about like employability skills and
Yeah.
all those kinds of things, I think of like ability to relate to others, flexibility, sense of humor, all those different types of things. What would you say is the most needed skill?
Communication's a really big one because we interact with our patients. So that is what I am most passionate about is patient care. I can teach anybody to do the skill set after a long enough period of time, but I can't teach everybody to be compassionate and to care about their patients. And I always tell my students, and they'll laugh if they ever watch this, but I tell them that if I walk into an ultrasound room to get an ultrasound and I see you're my sonographer, I'm like, yes, because I know that they're going to care for me like I need them to. And I want all sonographers and really all medical professionals just to treat each patient like it's their mother or their grandmother or their father. So that is something that's super important, is being able to talk to your patients and care for them, yet still get the images that you need to help diagnose what's bringing them in.
Yeah. Oh, that's wonderful. Students, don't forget to type your questions into the chat box. So the different options for where you can work,
Mhm.
clinic, hospital, are there any other options?
Yeah, so hospital is the biggest employer that we have generally. There's clinics, so that would be more of your banker hours, where clinics aren't open on weekends. There would not be any call. So clinics that we generally work on are going to be like musculoskeletal clinics, where we're looking at tendons and muscles, vascular clinics, where we are looking at those arteries and veins and doing surgeries to see if we can remove varicose veins, things like that. Generally, though, the most bulk of sonographers do work in the hospital setting. There's also things you don't think about in ultrasound. So there's an ultrasound machine anywhere you do ultrasound. Someone has to come to these sites and sell that ultrasound machine, and somebody has to come to that site and install that ultrasound machine. So that's another avenue where we can kind of go into if we don't want to work in the clinical world after a while. And then obviously education is something we go into.
What type of growth opportunities do you see in this career?
Yeah, we generally have staff sonographers that are, going to be doing all the scanning, seeing the patients, but we always have a lead sonographer who's that more upper level sonographer who can kind of do the budgets and can do the staffing. So when are you working, kind of the patient management. There's managers of ultrasound departments or managers of the radiology department. So there is kind of this step ladder that you can continue climbing up if you wanted to do more than just be the general staff sonographer.
Okay. We did get a question in from the classroom. Are there similar or crossover careers that are similar to this, or do similar tasks, responsibilities, do others have those as well?
I think that anything in the radiology profession is very similar to specifically sonographer. So it just depends on, I would say radiology in general is taking some type of high technology to figure out what's wrong with your patient's insides. So how you get those images is really what specializes us. So X-ray uses X-rays, MRI uses magnets, ultrasound uses sound waves. So it just depends on what you're using to get those images. And we all have benefits and trade-offs. So I said before, I can't see through air. CT and MRI can. So we really all work together in this big radiology unit to get tests ordered that meet the needs of our patients. And they might get multiple tests. They might have a CT and an X-ray and an ultrasound all on the same day.
Wow. Let's talk for a minute. And I know this is outside or beyond the sonographer, but your education, your master's and your doctorate are in public health, you said, correct?
They're in healthcare administration or business. My doctorate's in business.
Okay. And are you using those degrees right now?
Yes and no. So it's a healthcare background. So I come from healthcare. My students go into healthcare. So for sure that aspect of it. Now, like the research stuff that I did in my doctorate, I don't use every day in practice, but there's a lot of opportunities in our profession to educate other sonographers. So we have professional journals that I write articles for, and I use those, the background in my doctorate level degree to help write those articles and analyze those statistics. Education is never bad. It's always going to increase your awareness and just make you a better person. I don't necessarily use it every single day because it wasn't an ultrasound, but there is one program that I know that you can get your PhD or your doctorate in ultrasound.
Oh, wow. Okay. And you had said you had read a research study earlier that takes a specific education. I know I've read several as well, and it's always like, oh my goodness. Do you feel that that's helped you being able to read those?
Definitely. It's kind of my new avenue that I really have kind of went into is more the research and case studies. So I showed you that picture before about that really abnormal fetal head and writing about that so that other people can learn, because maybe there's only 10 cases a year on that we see in the United States. So the chance is that if you're a sonographer, you might not see that. And we really learn the best off of other people.
Yeah. Is this something that's used around the world?
It is. It is. It depends which level. So for example, in Europe, it's very similar to here in the United States, same with Canada, but there are countries where providers or physicians are actually the only ones that do the ultrasound. So it's very dependent on where you're located.
Okay, good. Well, we're getting to the end of our time. So students, if you have any other questions, feel free to put them into the chat box. Do you ever get to travel for your position, either one of your positions?
Yeah, actually, there's something called travel sonography. And what it is there's travel companies that you work for where you have assignments to different areas in the United States or the world. But for example, maybe somebody's on maternity leave or they had a surgery and this hospital needs a sonographer, not full time, not forever, but only for 12 weeks. And so they ask for a position through this travel company. And if I worked for them, let's say I would go to Hawaii for 12 weeks, I'd work a full-time shift there. They pay for everything, housing, food, relocation, and you get your salary on top of that. And then when your assignment's done, you can take a break or sign up for another assignment. So almost every medical professional has that opportunity to do that travel work. I did it a little bit. I think it's a very unique opportunity. And you get to see the world essentially for free because they're paying you to go to these places.
Wow, that sounds like a great way to travel and see the world.
Yeah.
What can students do while in high school yet to prepare for a career in this field?
Yeah, anatomy and physiology is big. So knowing your anatomy, anything that would give you that patient care skill set. And that is so hard to get when you guys are high school students, but whether it be customer service, if you work at any fast food chain, you are working with customers, that's customer service. And that's what healthcare is. Our customers, we're taking care of them. A CNA, so a certified nursing assistant, is not required to get in, but at some places it is. But that gives you that little bit of healthcare knowledge and that patient care that is essential for ultrasound. We don't perform a ton of the nursing skills, but it gives you that background that really sets you apart from other candidates.
Yeah, I think that's so great that they've made CNA available for high schoolers. And many of the schools are partnering with local organizations to be able to offer that at 15, take the test at 16, and then get into it.
And it's a great paying job when you're in college too.
Yeah. I'm just going to ask two more questions. Tell
Yeah.
us about the most unique, scariest, funniest walking into the room, the patient room, or, your room where you do the work. What has ever happened that's kind of thrown you for a loop or,
I was a student actually, and I was performing a leg ultrasound on a young gentleman. And I thought my communication skills were great, right? But I had said that you need to remove your pants from the waist down so I can scan the entire leg. And I must not have been specific enough because when I walked back into the room, the patient didn't have any clothes on. So I just handed him a gown and said, I'm so sorry, but I've definitely learned to be very specific in my communication skills.
Yes. Oh, that's wonderful. Good learning experience, right?
Exactly.
Yeah. Well, Amanda, if you had any advice for these high schoolers, what would it be?
Research. A job seems great on the surface. Ultrasound is a great job, but there's drawbacks too. There's drawbacks to every profession. So just make sure you do your research, that you thoroughly understand what you're getting into, because you want to love your job. It's not a job if you love it. I come to work every day loving my job. It doesn't seem like work. And I would hate to have anybody in the position where they really dread going into work every day. You do your whole life work. I mean, you spend more time at work than you do with your family, and you really need to enjoy it.
Yeah, wonderful advice. Well, students, we appreciate you coming in today. And Amanda, we thank you for your time and sharing about your career. Again, something that, again, not many people know about. And it's wonderful to hear that there's just different pathways to get there. Well, actually, a question popped into my head. If a student did the certificate or the 2-year, would it be possible that there are companies, hospitals, clinics that would then pay for going back and getting that 4-year or 3-year?
Absolutely. Yep. Most organizations have some type of tuition reimbursement where they want you to get more education to advance what you can give to the patients.
Yeah. Oh, good. I always like that option.
Me
All right.
too.
Well, wonderful. Again, students, yeah. Thank you for being with us, Amanda. Thank you. And best wishes to you in August.
Thank you.
Yes. All right. Wonderful. Thank you, everyone.
Bye.
Bye.